Hello class, my name is Kenneth Harp and today my presentation will be on diabetes. I'm going to be talking about what is diabetes, what are the causes of it, the symptoms, as well as what exactly is the current state of diabetes and what are the new treatments and new research that's being done in regards to diabetes. So what exactly is diabetes? Diabetes is something that we've all heard of before, whether it be through a friend that's had it, or a relative, or even a close loved one that's had it. It's something that we've all heard of before, but many of us aren't really, we don't really know exactly what diabetes is. So diabetes is a chronic disease that affects the way that our body uses glucose or blood sugar. There's lots of symptoms that come along with diabetes that I will get into later in this presentation, but symptoms of diabetes vary depending on which type of diabetes an individual may have, with type 1 or type 2 diabetes being the most common. However, individuals with type 2 diabetes may take some time to develop common symptoms, while people with type 1 diabetes may have a tendency to experience symptoms more quickly, and these symptoms may come with a more severe effect than others would. So going more in depth to what exactly diabetes is. So normally through the consumption of food, our body will receive glucose, and then our pancreas will process that insulin as well as move the glucose throughout our body to our muscles and different parts of our body. But where diabetes takes its effect is when our pancreas fails to produce sufficient amounts of insulin, and then in turn our body cells lack energy and can cause our body to experience high glucose levels, kidney damage, and many other things. So like I said earlier, the most two common types of diabetes are type 1 and type 2 diabetes, but a lot of people don't know that beyond that there's actually 4 total different types of diabetes. The first one is type 1 diabetes, type 2 diabetes, gestational diabetes, and also prediabetes. In the following slides, I will go more in depth to what exactly each one is, what are the symptoms, and how it takes different effects on our body. So first off, we have type 1 diabetes. Type 1 diabetes is normally diagnosed early on compared to the others. This is usually done as a child, and insulin shots play a vital role in controlling the effects that type 1 diabetes has. They need to take those daily insulin shots to be able to keep their insulin levels high, and there's no specific cause exactly to how someone gets type 1 diabetes, but there has been research and tests to prove that there has been hereditary factors that play into getting type 1 diabetes. Second off, we have type 2 diabetes. So like I said earlier, in comparison to type 1 diabetes, where it's usually diagnosed at a very young age, early on in their life, with type 2 diabetes, it's done during adulthood, but that doesn't limit it to just that. It could still be diagnosed at a very young age. It's the most common type of diabetes that you'll hear about and see cases of, and what makes it different from type 1 diabetes, where it's your body not creating enough insulin, with type 2 diabetes, it's your body's misuse of insulin, meaning it's not sending it to the right parts of your body, and it's just misusing it. So next we have gestational diabetes. Now, gestational diabetes is a new term for me. Prior to doing my research on this, I've never heard of it before, but after doing my research, I've learned just how important it is and the effects that it can have on not only the individual, but the baby as well. So gestational diabetes is developed during pregnancy in women, and it causes blood sugar levels to rise, and like I said earlier, it can affect the health of the baby, which is what makes it really important that it's controlled and minimized by the consumption of healthy foods and medications as well. These medications can be prescribed by the doctor, and it's important that this is controlled just so that not only for yourself, but also, like I said earlier, the health of the baby as well. Lastly, we have prediabetes. Now, prediabetes is that little in-between stage where you still have high blood sugar levels, but you don't have it to the point where you can be classified as having type 1 diabetes, but it does kind of serve as that little red flag that we do need to change our eating habits, exercise habits for the better. So, like I said, Prediabetes takes place when your blood sugar levels are above average but not high enough to be classified as type 1 or type 2 diabetes. And it gets worse with bad eating habits, insufficient amounts of exercise, which is why it's key that if you do get tested and you do have prediabetes, it's important that get your exercise in, make sure you're eating healthy, some of those basic things. And an average of 80 million people a year are diagnosed with prediabetes. And while it may look like prediabetes doesn't have a huge effect, but it does have that big effect in the long run, which is why it's really important that you take control of it now while you can and make those changes to try to help yourself. So now we have the most common symptoms of diabetes. It's important to keep in mind that these are only the most common symptoms, but there are also other symptoms of diabetes. So we have high frequency of urination throughout the day, so you'll have people going more than above average times to the bathroom throughout the day, blurry vision, fatigue, hunger that doesn't go away even after eating, constant thirst, tingling in both the hands and feet, and then abnormal weight loss. And then also it's important to remember that sometimes none of these symptoms will show, but you will still have diabetes. So that's why it's important to get tested. And later on in this presentation, I will show the different ways to get tested for diabetes. So now we have the ways to get tested to see if you have diabetes. So right now there's two main methods that are being used by doctors, and the first one is OGTT, which is the oral glucose tolerance test, and we have the FPG, which is the fasting plasma glucose test. In the next slide, I will go more in depth into each one and how the process works for each one. So first we have FPG, which is the fasting plasma glucose test. So the process for how this takes place is the doctor will draw your blood and results can take anywhere from 8 to 10 hours to come back. And then there's two levels that you can be at. So if results come back with your blood glucose levels ranging from 100 to 125 milligrams, that means that person is pre-diabetic. But on the other hand, if your blood glucose levels come back and you're ranging over 126, that person has type 2 diabetes. So second, we have OGTT, which is oral glucose tolerance test. And the way that this differs from FPG is that with FPG, they just draw your blood and you get your results after in like 8 hours. But with this, they give you this mixed sugary drink to see how your blood will react. So they give you the mixed sugary drink, and then 2 hours after you finish consuming it, then they draw your blood to see how it reacts to that sugar. And then if your blood glucose levels are anywhere between 140 and 199 milligrams, then that person is determined to be pre-diabetic. But if your tests come back and your blood glucose levels are over 200, then that person is considered to be a type 2 diabetic. Now we move on to the current state of diabetes. So sadly, there isn't a cure yet for diabetes. However, there are treatments to help control and minimize symptoms of diabetes. This includes insulin shots, and then another key one is to be able to keep a good diet and keep a good daily exercise routine. And this is key for whatever type of diabetes you may have, whether it's type 1, type 2, gestational, or pre-diabetic. It's important that you keep a good diet and get in your exercise, because while there is no cure, this can help in controlling and minimizing those symptoms. Like I said earlier, there is currently no cure for diabetes. However, there is new research coming out on islet cell transplantation. So islet cells are these clusters of cells in the pancreas that aid in producing insulin. So with this procedure, they take those islet cells out, they process them, and then they put those into the diabetic recipient, and this helps them in producing those insulin cells so that they don't have to take those daily insulin shots. And while it might not be a cure, it does help in making the daily life of the diabetic a lot easier. So this concludes concludes my presentation. I hope you guys all learned something, and I hope that you enjoyed it as much as I enjoyed making it. And I also look forward to seeing the rest of your guys' presentations. And I'd like to thank Professor for giving us this opportunity to research and learn about all these topics and really educate not only ourselves but the rest of the class. So, thank you.